Hey everyone, welcome back to the Mass Retirees Weekly Update. I'm Sean Duhamel. Today's Friday, July 16th. Thank you so much for tuning in again this week. I think you can see from behind me that the sun is finally shining here in Boston after a very rainy few weeks. I think many of us here have mushrooms growing in our yards right now, so it's nice to see the sun and the return of summer. Before I get into this week's weekly update message, and you know this comes out to you every Friday morning. We send an email out for Mass Retirees. We post this video to the Mass Retirees Facebook and YouTube pages, as well as to the Mass Retirees website. And if you haven't done so already, and if you're on Facebook or you're on YouTube, please just take a moment and press the like button that's on the page, follow the page, engage with these messages. We use this as a means to getting you the most up-to-date and accurate factual information in a timely manner that we possibly can. So it helps us to help you if you like the page and you follow along. It just makes sure that you're not going to miss anything that comes out. Before I get into this week's topic, which is going to be health insurance and healthcare, let me provide a very quick update on the state budget, as well as at the end of this message, I'm going to talk a little bit about Social Security WEP reform. In terms of WEP reform, there's not a lot of new news to report, but I'm going to get to that in just a few minutes. In terms of the state budget, as we reported a week ago, the budget is now on Governor Baker's desk. He is evaluating the budget. He has a full 10 days in which to do so. That expires next week. We're anticipating at some point this coming week, the governor will sign the budget, which will include a 3% cost of living increase for state and teacher retirees. The budget also contains in Section 18 of the outside sections a provision to increase the allowable hours the retiree can return to part-time public sector work to 1,200 hours a year. We have not received word yet if the governor is concerned about that language or not. Time will tell, but we'll know more on that next week. And I would anticipate that next week's video will focus on the budget just being signed. But in terms of healthcare, if you've been a member of Mass Retirees for a while, or if you followed along with these issues, you know that one of the main areas that Mass Retirees is known in terms of our expertise and our day-to-day work is on health insurance and healthcare policy. The majority of our members receive their health insurance benefits from really two sources. One, if you're a state retiree, or if you're a local retiree whose community has joined with the Group Insurance Commission, you receive your healthcare benefits from the State Group Insurance Commission. The other block of members receive their health insurance benefits from the city or town or district or county that you retired from. Many of the local communities have banded together through local insurance purchasing groups, such as the Mayflower Group down on the South Shore, or the Cape Cod Municipal Health Group, or the West Suburban Group, or the Berkshire Group. There's a whole bunch of different groups. Another main group out there is provided by an entity known as MIA, the Massachusetts Interlocal Insurance Association. I hope I got that right. But MIA is the health insurance arm of the Mass Municipal Association that represents all the cities and towns. And they represent, I think, well over 100 communities, mostly smaller towns throughout Massachusetts, and they deal exclusively with Blue Cross Blue Shield. So there's a bunch of different moving parts, but for today's focus, I'm going to focus on the State Group Insurance Commission. And the reason for that is that really two reasons. One, the GIC is the largest health care provider in the state of Massachusetts, bar none. That's both private sector as well as public sector. The GIC insures over 460,000 individual lives. That's a lot of people. So there's a lot of influence and buying power in the policies, and the decisions made by the GIC are very quickly emulated throughout Massachusetts. In fact, state law now allows cities and towns to enact the same plan design and benefit applications that the GIC uses to emulate that at the local level without the need to collectively bargain. So that's a big deal. And that's why we put so much attention and focus on the GIC, because what starts out as state policy very quickly becomes local policy as well. So everyone's in this together regardless of where you're retired from. The other reason why we've chosen this week to focus on the GIC is that the GIC is soon to begin a new insurance contract renewal process. The health insurance plans that are being offered today through the GIC will only be available for another 2 years. And if you've been at this for a while, you may recall that the GIC operates on what are typically 5-year contract cycles. Every 5 years, they have to go out for a new RFR, which used to be called an RFP. Not really sure why they changed that, but it's now RFR, which I believe is request for review, if I'm not mistaken. If any of you can correct me, feel free, but it's known as an RFR. But a year from now, the GIC will issue an RFR for FY24. I think we're going into now, 2 years from now. We're now in FY22. Next July will be FY23. So beginning with FY24, we will have a brand new health insurance contract at the state level. That health insurance contract process also involves prescription drug benefits. And right now there are 2 prescription drug benefit providers, one for Medicare retirees, which is run through CVS and the SilverScript plan, and for the non-Medicare retirees, it's Express Script. All of those contracts are up for renewal. So right now, the GIC is going through basically a fact-finding process of speaking with groups like Mass Retirees, speaking with the public employee unions, various stakeholders, speaking with the insurance companies and the hospitals and the doctors, gathering all these facts and information to try to put together what the plan is going to be for the coming 5 years. And it's a really big deal because once those contracts are issued and those benefits are locked in, we're going to be stuck with them from some period of time. So it's important that we make sure that we have input in this process and that we do the best we can to advocate for the best possible plans. And it really begins with maintaining affordability while also maintaining the highest quality benefits that are possible. For us, those 2 key items go hand in hand, and it's not always easy to achieve both of those things at the same time. So in addition to myself and Nancy McGovern and Bill Reary and Frank Valeri and the rest of us here at Mass Retirees, of working with Matt Vino, who's the executive director of the GIC, and his staff, and them asking us for our opinions, and they're doing that. We're constantly in contact with the GIC leadership, as is the leadership of the unions, and we all are working together on this. But it's also important that you have the opportunity to weigh in, because after all, at the end of the day, these are your benefits. This is extremely important, I would think, to all of you. And I know that many of you have expertise and thoughts and feelings and experience of being a health insurance consumer. And we want to make sure that you have the ability to have your thoughts recorded and to have a voice in this process. So that really begins today. And not to say that you don't always have open access to us, because you absolutely do. And I know that a number of you guys share this type of information with us all the time. But I want to put out a formal request. If there are specific things that you like about your insurance that you don't want to see changed, or things that you would like to have the GIC consider and take a look at entering into this next contract process, we want to know about it. So if you're watching this on YouTube or on Facebook, leave those comments below. You can also email me or email the association. But more importantly, we're going to set up in the coming months the ability for you to directly communicate with Matt Vino and his staff at the GIC. At some point this fall, we're going to hold another Teletown Hall event, very similar to the ones that we've had in the past. And if you may recall, a year ago, we had Matt join us for over an hour, and he spent the bulk of that time speaking directly with you and answering your questions and gathering that information. And I know it's something that he believed was very valuable on his end. And he recently reached out to us and asked if we can arrange for that type of meeting to take place in the near future, with the goal of soliciting your opinions and your thoughts entering into this next contract process. Because again, a year from now, we're going to be in the thick of this. Now, at this point in time, we don't have any general sense of where things are going. No decisions have been made. They're not even speculating of what the future may hold. But we know healthcare is expensive. We know it's complicated. We know living in Massachusetts and the bulk of you are receiving your health insurance benefits and your health care right here at home in Massachusetts. That we live in a very high cost state. We have some of the best hospitals and doctors and medical providers anywhere in the world located right here in Massachusetts, but there's a cost to that. And all of those things need to be taken into consideration. But from our standpoint, the most important thing is maintaining high quality and affordable insurance, preventing and avoiding cost shifting onto you, finding a path into Medicare for those of you who are over the age of 65 but are not eligible for Medicare. We know that by joining Medicare it can lower your costs, so we are urging the GIC to continue to work with us and find a way to enroll you in Medicare. We also want to do more for our out-of-state members. We hear from those of you who are living outside of Massachusetts quite frequently in terms of the cost and the variation of selection that you would like to see available to give you more than one option, for instance, of a health plan to enroll in. These are all the types of things that we're talking to the GIC about. So with that, I'm going to sign off for today, but let me close by just a quick update on the Social Security windfall elimination provision. Inevitably, every week, many of you are tuning in, very hopeful for some good news in terms of the WEP, and we're continuing to make progress. And if you don't see anything being said or written about this, that doesn't mean that we're not working on it, because we are. Every single day we're working on this. But there isn't always going to be new information to provide to you. The best I can tell you right now is we're continuing to make progress. This past week, we gained further support from retiree organizations in the state of California. There is definitely a renewed effort and interest amongst all of the California retiree groups who are right in the thick of this, just like we are. Their members are subjected to the WEP, just like you are. So we share a vested interest in getting this issue resolved. And they are putting their resources behind this effort just like we are. So this past week, San Diego County joined with us, as well as the City of Los Angeles retirees. So the list of groups is growing. I believe we're now up to 56 different organizations around the country. The last I checked, we still had 170 co-sponsors of the bill in the House of Representatives. And our focus right now is to continue to urge Republicans and Democrats to find a way to come together behind a common unified bill to reform the WEP that can pass the House and has the votes to pass the United States Senate this congressional session. So with that, I'm going to sign off for today, but thank you so much for tuning in. Get outside and enjoy this beautiful summer weather if you're here in Massachusetts or regardless of where you may be, but thank you very, very much for your support.